Hello, my name is Joe Ebner. I'm the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. I want to welcome you to this COVID-19 update, Wednesday, May 6th, 2020. This update is intended for the residents of the greater Plymouth community in central New Hampshire. I want to thank you again, all of you across the community, for your social distancing and isolation efforts, which have really worked to flatten the curve of the COVID-19 outbreak in New Hampshire. It has been a busy week from the State House in Concord up through Plymouth as we change gears from mitigation to containment. More about that in just a few minutes. But first, what is the COVID-19 situation looking like in New Hampshire? Many of the predictive models for surge were a couple of weeks ago. New Hampshire hospitals remain in a good position with staffing, bed and ventilation availability, and PPE equipment to take care of the citizens of New Hampshire, largely because of your efforts to socially distance and isolate. Our state's hotspots for COVID-19 continue to remain along the southern tier Massachusetts border, but those hospitals are also doing well to care for the sickest patients in their communities. It will remain to be seen what will happen as residual disease lingers in the upcoming months around the state and around the country, which is why we must focus now on containment to keep any future outbreaks contained as we move forward. To date, there have been 2,600 patients confirmed with COVID-19 in New Hampshire, and 92 deaths attributed to COVID-19. That's a 4% death rate. There have been 295 persons hospitalized across the state, which is 11% hospitalization rate. The number of tests that have returned positive have increased across the state, but that's largely due to the increased testing that has been performed across the state. When we look at who is sick and in the hospitals, we have not seen an increase in hospitalizations over the last couple of weeks. Specific to Plymouth, in our community, we remain with just a handful of COVID positive tests over the last couple of weeks. We do not see any evidence of widespread community-based transmission in our greater Plymouth community, but we are certainly not in the clear. We must remain diligent in our efforts of containment. What has been Speare's response to COVID to date? All of the practices in our community have opened themselves up to telehealth so that you have the ability to communicate and have a visit with your provider through a secure network. If you simply call their practice, they will be happy to hook you up. We continue in the hospital to separate our respiratory illness patients from others, keeping a potential COVID area free from the rest of the hospital, safe from other patients, safe from the staff as well. We continue to work with our public health emergency preparedness partners. As I've mentioned in previous broadcasts, we had a Plymouth Alternative Care Site, or a PACS, that we have stood up at the Plymouth State University ice rink. It is unlikely at this point that we feel we will need to use that, but until the governor asks us to remove it, it will stand and ready to be used if needed. Our attention the last week or two has been to document how that is set up so that when the time comes to deconstruct it, should the need arise in the fall or next winter or at some future time, we'll be able to stand it up quickly with the help from our greater community partners. We've also been working with the Department of Public Health in this last week to increase testing. As many of you are probably aware, the National Guard Armory in Plymouth runs a state of New Hampshire COVID collection site. This is open 7 days a week. It does require an order from the provider. So if you call your practitioner with concerns that you may have COVID or may be exposed to COVID, they will be able to get that order for you to be done that day or the next day at the National Guard Armory. If you do not have a primary care provider, you can always call 211 within the state of New Hampshire, and they will direct you to how to get that testing done. Those results are sent out to an outpatient or to a third-party lab, Quest lab, and the turnaround time is between 2 to 4 days. The results are returned to your provider to communicate those results to you, and your insurance is billed, and if you don't have insurance, the state will pick up that cost. This is done in an effort to try to get a handle around how much asymptomatic disease might be in our communities across the state. A frequently asked question is whether we can test for antibodies. As many of you know, once we are exposed to a virus, our body develops what's called antibodies that provides immunity from future infections. This is why most of us only get chickenpox once, for example. Unfortunately, the jury is still out on what's the best test for antibodies. Although this is a new coronavirus, a new strain of the coronavirus has been around, and so there are people in our community who already have resistance to some of the other strains of coronavirus. And we don't yet have the technology within the tests to determine whether you are immune to COVID-19 or one of the other coronaviruses. So Speare, as well as the rest of the doctors and nurses and laboratory technicians around the state, continue to monitor and looking at the literature. And as soon as a reliable antibody test is available, we suspect we'll be rolling that out. So what can you do now to keep yourself safe? Wash hands, and wash your hands. The majority of infections come from an infection on your hands that then gets spread to your face. Also, avoid touching your face. When you sneeze into a tissue, throw it away immediately and wash your hands immediately. Maintaining distance from crowds will also help to reduce asymptomatic spread. If you do need to go into a crowded area where a 6-foot spacing is not realistic, like the grocery store, for example, wear a cloth mask. As far as symptoms go, if you are feeling mildly ill, call your physician, because you can now get testing through the National Guard's site at the Armory in Plymouth. If you are feeling severely ill and feel you need to be seen, again, call your physician. They might be able to arrange a telehealth visit or might direct you to come in to be seen in person. If you are feeling it is emergent because of shortness of breath, hard time breathing, you can always come to the Speare emergency room. It's available 24/7 to care for any concerns you might have. If you're uncertain about where to call or who to call or where to go, you can always call Speare's hotline at 603-238-6464. That number is at the bottom of the screen. It is answered 24/7 by a registered nurse that can help direct you to care. It's been in the news quite a bit in the last week about relaxing some of the social distancing measures that have been put into place over the last 6 weeks. Please know that the state, as well as the New Hampshire Hospital Association, is working in a cautious way and working with public health experts to roll out this in a coordinated way around the regions and the state in a slow manner that will be phased, that balances both the interest to return to normalcy with some due restraint. As we move towards a containment strategy, we needed to have certain things in place, which we now feel are in place. One is a healthcare system that is ready to accept a potential second wave of illness. And our New Hampshire hospitals are in a good position to move to containment. Second, increased testing capability. And over the last 2 or 3 weeks, we've seen a huge increase in that testing capability. The third thing we need is additional resources in public health for contact tracing resources. So if an outbreak does occur, that we have the ability to test and go after the potential contacts to keep them in isolation until they can be tested as well. The state continues to support isolation, whether it's working from home or limited use of restaurants and other places. We continue to see and support limiting the gathering size. And I think going forward, we'll have to continue to support remote working for those non-essential come-to-work jobs. All of this is done as we eagerly look forward to a future release of a potential vaccine. When I think now about returning some of the hospital services that have been on hold over the past month, I want you to know that Speare is proceeding in a very safe manner. The state has allowed us to open not just to emergency and urgent surgeries, but also to time-sensitive conditions. You might ask, well, what is a time-sensitive condition? Certainly for folks who might have a surgical need or procedure need to help handle and deal and treat with a cancer or a diagnosis of cancer, or maybe you have a cataract which is interfering with your ability to drive and you're a primary caretaker for a loved one, or maybe you have an orthopedic condition that is causing pain or reduced activity which is interfering with your daily life. These are some examples of time-sensitive conditions that aren't truly emergent or urgent, but if left untreated for a number of weeks or months, may lead to harm down the road. Speare would like to safely bring those procedures back and offer them to you, and that starts with first coming to see your surgeon or to your primary care provider so that we can screen whether your condition is one that is time-sensitive and how we can help take care of that for you. Please know that the employees at Speare Hospital are screened daily for illness, that our surgical patients that we bring to the operating room are all tested for COVID prior to coming to the OR in an effort to keep the OR area a COVID-free zone. We also, as I mentioned earlier, completely separate patients who may have COVID from the others. And as we move forward to increase capacity to testing and procedures at Speare, we will continue to limit visitors to decrease the risk of a potential COVID outbreak. As I've mentioned before, things change week to week. Please see the Mid-State Health Center or the Speare Memorial Hospital websites for the most up-to-date information. From there, you can be launched to other reputable websites like that by the CDC. I want to take this time to sincerely thank you, those of you in our community, for your ongoing prayers, your thoughts, and for the overwhelming financial support that many of you have provided to the hospital. What we need now from all of you is your trust. We need your trust in us as your healthcare provider, that as we look to increase access to those time-sensitive procedures, that you have your trust in us, that we have your best interest at heart, that we want to keep you, our staff, and our community healthy. Lastly, I ask that you not be afraid, but be well.